Tony Fauci's been doing it twice as long as I have, and most of you at the dais have been doing that.
The question before the country today is not whether to go back to school or college or childcare or work, but how to do it safely. Even though COVID-19 has not, in general, hurt young children and college-age students nearly as much as older and more vulnerable Americans, there is some health risk. But in my view, the greater risk is not going back to school.
And while this public health crisis rages across the country, we've seen a leadership crisis raging in the White House. As the president proves, time after time, he cares less about how this pandemic is impacting families and communities and more about how it makes him look.
While data is the backbone of this response, containing the outbreak depends on 4 core interventions: readily available testing, comprehensive contact tracing, timely isolation of known cases, and quarantine to break the transmission. We are not defenseless against this disease. We have powerful tools at our disposal: social distancing, wear a face cover in public, and be disciplined about the frequent hand washing.
We've got to make sure that when states start to try and open again, they need to follow the guidelines that have been very carefully laid out with regard to checkpoints. What we've seen in several states are different iterations of that. Perhaps maybe in some going too quickly and skipping over some of the checkpoints. But even because if a person gets infected, they may not be symptomatic, but they could pass it to someone else, who passes it to someone else, who then makes someone's grandmother, grandfather, sick uncle, or a leukemic child on chemotherapy get sick and die. We've got to get that message out that we are all in this together. And if we are going to contain this, we've got to contain it together.
All I hear, Dr. Fauci, is we can't do this, we can't do that, we can't play baseball. Well, even that's not based on the science. I mean, flu season peaks in February. We don't know that COVID's going to be like the flu season. It might, but we don't know that. But we wouldn't ban school in October. You might close some schools when they get the flu. We need to not be so presumptuous that we know everything. But my question to you is, can't you give us a little bit more on schools that we can get back to school, that there's a great deal of evidence, and it's actually good evidence that kids aren't transmitting this. It's rare, and that kids are staying healthy, and that, yes, we can open our schools.
I feel very strongly we need to do whatever we can to get the children back to school. So I think we are in lock agreement with that. The other thing that I'd like to clarify very briefly is that when things get in the press of what I supposedly said, I didn't say. I never said we can't play a certain sport. I agree with you. I am completely unqualified to tell you whether you can play a sport or not. The only thing that I can do is, to the best of my ability, give you the facts and the evidence associated with I know about this outbreak.
In which Congress appropriated $150 billion, I mean, one